Hi everyone, welcome to my YouTube channel. In this video, we will cover anemia, which is one of the most important disease or a topic in medical terms. So let's start. First, we will look what actually this disease is. So, anemia is basically a condition characterized by a deficiency of red blood cells or hemoglobin, leading to reduced oxygen transport to the body's tissue. It can result from various causes, including nutritional deficiencies, chronic diseases, and genetic disorders. So, what are the types of anemia? There are basically three types of anemia. The very first one is iron deficiency anemia, which is caused by insufficient iron intake or absorption. The second is vitamin deficiency anemia, which results from low levels of vitamin B12 or folate. And the last is hemolytic anemia, which occurs when red blood cells are destroyed faster than they can be produced. So, if you look at the broader picture of its prevalence, so anemia is most common disease. It affects approximately 1.62 billion people worldwide, with higher prevalence in developing countries. Women and children are particularly vulnerable due to higher iron requirements and lower dietary intake. So, what is the importance of understanding this disease? The very first one, that it has a very negative type of impact on our health. Anemia can lead to severe health complications, including heart problems, development delays in children, and increased susceptibility to infections. Chronic anemia can significantly reduce quality of life and increase mortality rates. The second one is economic burden. Obviously, this disease is like it includes healthcare costs, lost productivity, and reduced educational outcomes. Treating anemia and its complications can strain healthcare systems, especially in low resource settings. What are the social implications? Anemia can exacerbate social inequalities, particularly affecting women and children in impoverished communities. It can lead to stigma and discrimination, which further marginalizes and affecting individuals. Educational importance. Educating students about anemia is crucial for early detection, prevention, and management. Awareness campaigns can empower individuals to make informed health choices and advocate for better health care policies. What are the causes and risk factors associated with this disease? The primary causes includes nutritional deficiency. Obviously, iron, vitamin B12, and folate are the most important components of the process of making RBCs in our body. So the deficiencies of all these leads to a common nutritional disease, which is known as anemia. Poor dietary habits, malabsorption and malabsorption and increased nutrient requirements can contribute to these deficiencies. Genetic factors can also contribute. Genetic disorders such as sickle cell anemia and thalassemia can cause chronic anemia. These conditions affect the structure and functioning of hemoglobin, which is the most important part of the red blood cells, which leads to abnormal red blood cell production. The chronic diseases like kidney diseases, cancer, and inflammatory disorders can lead to anemia. These conditions often interfere with red blood cell production or increase their destruction. What are the risk factors of anemia, related to anemia? The very first one is obviously lifestyle choices. Poor diet, lack of exercise, and smoking can increase the risk of developing anemia. Alcohol consumption can interfere with nutrient absorption and exacerbate anemia. The environmental factors like exposure to environmental toxins and pollutants can contribute to anemia. Age and gender also play a very significant role, like women of reproductive age, pregnant women, and young children are at higher risk due to increased iron needs. Older adults above 50 years are also vulnerable due to age-related health issues and dietary changes. Medical history. A history of chronic illness, surgeries, or blood loss can predispose individuals to anemia. Family history of genetic disorders like sickle cell anemia also increase the risk. What are the symptoms and diagnosis? for this disease. The common symptoms include fatigue and weakness, uh, pale skin and dizziness, and shortness of breath. These are the most common factors or symptoms that an individual who is suffering from this disease, experience such type of symptoms. What are the diagnostic method in this category? Physical examination. Obviously, a physical exam may reveal signs such as pale skin, rapid heart rate, and low blood pressure. The doctor may also check for signs of underlying conditions contributing to anemia. Some blood cells, like complete blood counts (CBC), is the primary test to diagnose anemia, measuring hemoglobin and red blood cells level. Additional tests may include serum ferritin, vitamin B12, and folate levels to identify specific deficiencies. Advanced diagnostic tools like bone marrow biopsy may be used to in complex cases to assess red blood cell production. Genetic testing can identify inherited disorders like sickle cell anemia or thalassemia. Medical history. Reviewing the patient's medical history helps identify potential causes such as chronic diseases or nutritional deficiencies. Family history can provide clues about genetic predispositions to anemia. So, treatment and management options for this disease. Medical treatments includes vitamin B12 and folate. We know that vitamin B12 and folate are the important components of RBCs, and the process of making RBCs requires these two components. So vitamin B12 injections or oral supplements are used to treat vitamin deficiency anemia. Folate supplements are prescribed for folate deficiency anemia, often in conjunction with dietary changes. Iron supplements. We know that iron is the most important component of RBCs, so oral iron supplements are commonly prescribed to treat iron deficiency anemia. Intravenous iron may be used for patients who cannot tolerate oral supplements or have severe deficiencies. Blood transfusions. Obviously, in chronic case of anemia, blood transfusions may be necessary for severe anemia or acute blood loss. They provide immediate relief by increasing red blood cell count and improving oxygen delivery. What are the lifestyle and dietary changes of this related to this disease? Balanced diet is necessary. Obviously, a diet rich in iron, vitamin B12, and folate is essential for preventing and managing anemia. Foods like leafy greens, fortified cereals can help meet nutritional needs. Regular exercise. Obviously, physical activity can improve overall health and enhance the body's ability to produce red blood cells. Exercise also helps manage symptoms like fatigue and weakness. Avoiding alcohol and smoking. Limiting alcohol intake and quitting smoking can improve nutrient absorption and reduce anemia risk. These lifestyle changes also benefit overall health and reduce the risk of other chronic diseases. Stress management in this case is very important. Chronic stress can exacerbate anemia by affecting nutrient absorption and overall health. Techniques like meditation, yoga, and adequate sleep can help manage stress and improve anemia symptoms. What are the prevention strategies in that case? So nutritional interventions, which includes dietary supplements can be used to prevent anemia. Individuals at risk, such as pregnant women or those with dietary restrictions. Regular monitoring ensures appropriate dosage and prevents oversupplementation. Iron rich foods. Incorporating iron rich foods like lean meats, beans, and spinach into the diet can prevent iron deficiency anemia. Pairing these foods with vitamin C rich options enhances iron absorption. Vitamin rich foods like fish, dairy products, which has a significant quantity of vitamin B12. Folate is also important, and it can be found like in foods like citrus fruits, legumes, and can prevent vitamin deficiency anemia. A varied diet ensures adequate intake of essential nutrients. Public health measures. What measures be taken to ensure the well-being of an individual? So education and awareness programs. Obviously public health campaigns can raise awareness about anemia, its causes and prevention strategies. Educational programs in school and communities can empower individuals to take proactive health measures. Screening programs, like regular screening for anemia, especially in high risk groups, can facilitate early detection and intervention. Screening programs in schools, workplaces, and healthcare settings can improve outcomes. Policy and advocacy. Educating for policies that addresses nutritional deficiencies and improve healthcare access can reduce anemia prevalence. Collaboration between governments, NGOs, and healthcare providers is essential for effective policy implementation. Last, community support. Obviously it cannot be possible without the community support. Community based initiatives such as food fortification programs and support groups can help prevent and manage anemia. Engaging local leaders and organizations ensures culturally appropriate and sustainable interventions. Thank you for listening to me, and please subscribe to my YouTube channel. This is the very first video I'm going to upload, so please do support. Thank you.